All right, so we have now the Chinese pathology and diagnosis of urticaria. So the Chinese pathology and diagnosis of urticaria is called Fengyin Shen, which means wind hidden rash. Now, in both acute and chronic urticaria, there is usually an underlying pattern of wind in the skin. A very common pattern wind in the skin manifests primarily with intense itching, either all over the body or moving from one place to another. And in chronic cases like psoriasis, um, with dryness of skin. Now, just as wind in nature dries up the soil, wind in the skin may dry up the skin as well in chronic cases. Now, wind in the skin is neither an external type of wind because it does not cause exterior symptoms such as aversion to cold or fever, nor an internal type of wind pattern because it does not cause tremors or paralysis. Now, in acute urticaria, wind, especially wind heat, predominates. It causes intense itching with sudden onset and red wheals that spread rapidly. The more intense the itching, the stronger the wind. Take note. Now, in chronic urticaria, wind may be combined with a stomach and spleen deficiency and damp, which usually makes the patient prone to food allergies. Mm. Now, in this case, the wheals may exude a clear fluid, the itching is less intense, and the wheels come and go in a chronic course. Now, in chronic cases, wind in the skin frequently occurs as a result of deficiency in dryness of blood. Now, in such cases, the wheals may be pale red and the itching is less intense than in acute urticaria. Now, this condition is more common in women and may be associated with menstruation or may arise after childbirth. Now, most urticaria and acute and chronic urticaria may be accompanied by blood heat. Now, in these cases, the wheals are very large and bright red, and aside from the itching, the patient has also an intense feeling of heat, and the skin is really hot to touch. Now, finally, chronic urticaria may be complicated by blood stasis, and in which cases the wheals are purple and may last a long time. So this is a summary of an urticaria in Chinese pathology and diagnosis. So it has an intense itching, sudden onset, red wheals that spread rapidly, which means uh, when heat, wheals that exude a clear fluid with less intense itching. The wheals come and go. That's wind, stomach and spleen chi deficiency, and dampness. Now, when we have pale red wheals with less intense itching, we have the deficiency and dryness of the blood. It has a bloody pattern when the urticaria is large, right? Red wheals. It has itching, feeling of heat, and then the skin is also hot to touch. Now, it would be blood. There would be blood stasis if the wheals are purple. That lasts a long time. So, yeah, another example of urticaria. So you can see these are chronic. Well, thank you so much. Very